Hello, this is Nina and I am here at New Life Plastic Surgery with Dr. Dress.
Hi Nina, welcome and thank you for coming.
Thank you.
I understand we are going to be helping you with an issue that you've had your entire life and you finally got the time to address it for yourself.
Yeah, so, throughout my adulthood, growing up, I've always had this saggy boobs. I grew up having the saggy boobs.
Okay.
I've never really had a standing breast.
Okay.
So it kind of like affected my self-esteem.
Got it.
Yeah. So when I had my first child, my breast even got worse.
Okay.
Because it got bigger. I never had the opportunity to breastfeed because I had, it was COVID and he came early and all of that. So the second baby I breastfed, but it got bigger. The more the kids, the bigger the boobs, and the more it's getting lower. So I kind of like don't feel comfortable at all. So it's like I've waited this day my entire adult life. So yeah.
Do you have pain anywhere in the chest, neck, or back region?
Back pain, and sometimes if I'm laying down facing up, my boobs kind of like clap together and it hurts my chest.
I got it. Any rashes or?
Yes, it gives me rashes too.
Yes ma'am, yes ma'am. Okay.
Yeah.
Very good. Is there anybody directly related to you by blood who's ever had breast cancer?
No.
Wonderful. That's wonderful news. Okay. This operation reduces your lifetime risk of getting breast cancer even more.
Oh.
So it'll be below the general population for the rest of your life.
Wow.
And it's not just because we're removing tissue and skin tomorrow, but also because your immune system goes on high alert during the healing phase and it goes after anything even remotely trying to become something like a tumor later on.
Wow. Wow, that is good.
The potential downside is if you were to have another child, your breasts may very well get large again and or they could stay large, and it's possible that you may not be able to breastfeed should you try again.
Okay.
About 30% of patients can, but we don't know who those are until they try. Right.
Yeah.
So that's something to keep in mind about the operation as well, because hormones control the breast tissue size.
Wow.
Yes, ma'am. And babies have a lot of hormones moving around.
Does that happen when we get an implant?
So an implant generally does not interfere with breastfeeding because the breast tissue and all of the nerves and blood supplies feeding it are pretty much uninterrupted, especially if we go under the muscle.
Oh, okay.
But even on top of the muscle, most patients can still breastfeed if they try.
And then when someone gets a breast reduction plus implants, that's like no chance for breastfeeding?
It's very difficult, yes ma'am, especially because we use different parts of the breast tissue to keep the nipple blood supply intact, and a lot of times it's from up here instead of down at the bottom, and that creates even more difficulty to being able to reliably breastfeed in the future.
Okay.
Good question.
Yeah, because I've heard that I can't be able to breastfeed, which I really don't have issues with.
Got it.
Because I barely did breastfeed any of my kids.
Okay.
But for people that want to get a breast reduction, they need to know that they have lower chances of breastfeeding their child if they kind of like.
Absolutely.
Or some people haven't even had a child before and they want to reduce their breast, so they need to also know this. So it's
I tell anybody who needs or wants any type of breast surgery, if you want to breastfeed, do not have surgery until that whole process is complete in your life.
Okay. I'm ready.
Very good.
Very ready for it, and I'm excited.
At this point, do you mind if I ask what bra and cup size you're wearing right now?
So I wear a G.
Okay. So typically an average reduction, and you're beyond average, but an average reduction will be about 2 cup sizes smaller. And of course, if we're going from a G, what cup size do you think would fit your frame and your mind, kind of your mind's eye?
So when I'm buying a bra, I go for triple D, right? but you know, I think that's what I'm putting on right now. But it kind of like don't cover up all my breasts, so that's why I said G, because I might be a G, but I have never gotten a G cup before. But now I want to go all the way down to either a B or a C.
Okay.
I don't know how possible that is, but that's what I want. I want to go very down and also have a very standing breast. At least I need to experience that.
Absolutely.
Part. Yeah.
And that's doable. The issue with size is with the amount of tissue that's necessary to keep the nipple and areola, blood supply and nerve supply intact. In general, my hand is about the size of the volume. And so that's a C cup and a 34. Now, what is the number on your bra?
I wear 30. I wear 40.
Okay, so it would be a little bit more tissue than my hand in order to keep the nipple and areola alive. And so with that said, you'll probably be a full C and maybe even a small D in some brands. If you go to boutique manufacturers, and the classic example is Victoria's Secret, even if you're a C cup, they're going to say you're a D or double D. The opposite happens with, you know, brands like Soma. You go there and you're a C cup, they're going to tell you you're a B. So they want you to buy a bra and make you feel better about yourself, and they're willing to fudge the numbers a little bit to make that happen.
Yeah.
Okay. When I'm talking about bra cup sizes, I'm generally referring to off the shelf at Walmart. You know, those are the ones that are most accurate when it comes to just a patient going in and finding something that fits.
Right.
But the best way to get measured for a bra is to go to a store such as Macy's, and that way they are excellent at getting the patient the right bra size.
That way you're able to try on and
you got
see.
it.
Yeah.
And you'll be much more successful finding something that fits and fits comfortably. But yeah, I think that I'll shoot for a large C tomorrow, and that's probably the B is not realistic because we need more tissue to keep everything alive and happy.
I mean, you can actually, when you see my breast tomorrow, you can determine what size I am, because I really do not know for sure.
And that's not uncommon. I think I remember an Oprah episode where 90% of the ladies were wearing the wrong size bra out there. Yeah. So, but then again, there's no standardization among bra sizes anyhow. So no wonder 90% of the ladies are, you know, wearing the wrong size.
Right.
So, do you have any medical problems that you're aware of?
No.
Okay.
No.
Ever had any general anesthesia before?
I always do. I've gotten like 2 BBLs.
And no problem with anesthesia?
At all.
Wonderful, wonderful. So the operation typically takes me about 2 hours to do. I don't use drains for breast surgery because the lymphatics in the armpit are so good that they can drain the majority of the breast fluid away. And we want you to stay in the best fitting bra around the clock for 6 full weeks, because that's how long it takes a healthy person to make 90% of their scar tissue strength inside the breast.
Okay.
To give you the really nice, full, perky breast that you want, the key is how I anchor that large portion of tissue we call the pedicle, how I anchor it up to your chest wall on the inside. And that way it won't fall on its own volition, and then you staying in the bra for 6 full weeks gets all the scar tissue to keep the breast in place.
Okay.
It's very common here, and especially here with you know, advertising and the internet and all the forums out there, and just being in the Miami setting, to use implants. But that's not the norm. In most of the U.S., we wouldn't start with implants. We start with a breast reduction and lift alone. And most patients have adequately firm and large amounts of tissue that we can work with, that it looks very, very, very nice and stays up very well, as long as they don't smoke and they are not diabetic, because those patients have hurt the blood supply to their tissues and things fall fast. So as long as you don't become diabetic or a smoker, this will stay up there and should stay up there for many, many years.
So the reason why I didn't want to get implants, because I don't know if I'm going to feel something inside of me. Well,
and you will. You will, because it's there, right?
Right.
Yeah, it's hard. You can't not feel it. And then implants, as good as they are, they're maintenance devices. You have to get an MRI at year 5. And then you have to get an MRI and ultrasound every 2 or 3 years after that.
Wow.
For the rest of your life.
No.
Yes, ma'am. And eventually, the data suggests eventually somebody's going to have, have something done about their implants. And, we don't, even as good as they are, they're not lifetime devices.
I heard that you have to change it at some point.
Well, that used to be kind of the suggestion out there. Today's implants don't have any expiration dates inside you. They don't have to be, if they're okay at the 10-year point, just keep going with them. But eventually, our body wears anything out inside it. And so most patients are probably going to have some type of implant reoperation throughout their lives if they live long enough and have the implants in them long enough.
So when I said I wanted to get a breast reduction, I told a lot of my fans, I told them, look at this procedure. This is what I want. A lot of people are like, no, don't go for it. We like you the way you are. It's not like it's a crime having a breast reduction. I'm having it for my health. I kind of don't feel good sometimes when my back hurts from having a very heavy breast. I just need it reduced so it can I can feel okay.
So you hit it on the head again. This is like the #1 operation for improved women's health in the world. And it's definitely the happiest patients.
Right.
The happiest patients are breast reduction and lift patients across the board.
Right.
It's such a radical improvement in your symptoms and in your shape and form.
And then it boosts your confidence.
Absolutely.
As well.
And every single lady is like, why did I not do this years ago?
No, I don't want to be like that. I want to get it because I want to feel good. I want to feel comfortable. And, I just want to feel myself when I'm out there.
Well, thank you for letting us take care of you. And I look forward to getting this journey started with you tomorrow.
I'm excited. Thank you.
It's a pleasure to meet you, Miss Nina.
You too. Bye.